Scoliosis and congenital fusion. Let's take a look at what happens by standing on one leg. This person here presented in the clinic with scoliosis, and you can see that the lower three vertebrae here have no discs separating each vertebra. So 5, 4 and 3 are actually fused. Number 2 and number 1 are independent, as is number 12 and 11 up there. The bottom angle of this L4 vertebra, fused vertebra, and the top of the T12 unfused vertebra go to make the Cobb angle of 45 degrees. And let's take a look at that from what it looks like before treatment. And we can see that the lower back actually has the curve in it down low, and it tends to angle with the center of gravity line being the red laser line from the top of the bottom. The whole body is over to the left. Now, when we take a look at what standing on one leg does for a period of 19 minutes, what we're seeing here is that the body can actually become straight. And we'll see that the unlevel shoulders actually become level, and the vertebrae themselves are now oriented above that crease or that cleft in the baseline. So let's take a look again at whether fused vertebrae really do make a difference to centering of the spine, and the answer probably is no. Most of you can see here this bottom disc represented by the black, the bones by the white, 5, 4 and 3, 2 and 1 are the lumbar vertebra, 12 is the thoracic vertebra with the rib coming off it. There is a disc space between the sacrum, which is the triangular bone down low here, the pelvis, the iliac crest, there is a gap here. The pivoting force that helped this person center occurred down low in here. Now, the importance of that is that once you take pressure off this side that is most compressed, now if we draw those angles in, and I'll just give you an idea as to what we're talking about here, but you'll notice how the lower lumbar spine is actually tilted off to the left-hand side. Again, this being the left, this is the right. Here is the left side in here. It's tilted to the left. Now, the more we compress this side in here, the more arthritis you get at this joint in here, and the more nerve pressure will result going down and into the legs as a result of compression. Now, what we want to do is really take that lumbar spine and continue to make it come into this vertical alignment. Well, to some degree, we can see that we've actually been successful. Let's take a look at a closer angle in here as well, and let's see what happens. So we'll get a little marking going, and we want to see if we can stop arthritis. So let's just see if we can. Now, how we stop arthritis is by essentially taking pressure over time away from certain levels of the spine. So what we're going to do here is just take a look at the angle from the apex of the curve, and we're going to copy that and paste it and place it over to the corresponding photo down low in here. And we can already see how that's gone through the crease, but now we've actually started to see that the spine is moving away. Consequently, the pressure down in this lower pivot point, that's that pivot point down in there, arthritis stops when you remove the degree of pressure over time. So that degree of pressure has eased. We can't stop time, but we've actually reduced the stress, the mechanical stress, putting pressure at that joint down in there. So a little something or other, just talking about how scoliosis itself can interfere with, how scoliosis can interfere with. We're now talking about how scoliosis interferes with arthritis. And it's important to know that if you remove the stress, because you can't stop time, but if you remove the stress, you decrease the chances of arthritis occurring down in here. Also, what's really important is that, yes, she does have a congenital fusion, or potentially it's an acquired fusion as well, possibly given some trauma, and there's evidence of that further up in the spine. But regardless, even if there is fusion there, the spine can still move, and it moves at the area that's unfused. Those segments which are not fused down below, and that's exactly what took place in this lady's spine when you can just compare it with the postural photo as well. All right, if you desire to know more about this sort of thing here, by all means, let's do something about that. You know where to find us. We're at St Jude's Clinic in Sydney, Australia, and take a look at the description item below. This can be done via Skype. It took 20 minutes to be able to bring her body back into centre, and obviously the more she practices that, the more it's going to stay there. Good news from St Jude's Clinic in Sydney, Australia. This is Daniel Dahdah.